Hello, Mitch Koval here, and for my video presentation, I'm going to be talking about lower back pain. The description of it is that it's basically it's an unknown cause of events. A lot of the books and journals talk about NSLBP, which is non-specific lower back pain. It usually comes from the spine, the bones, and the muscle tendons and ligaments around the lower back and attached to the pelvis. 90% of the lower back pain that most people experience is due to musculoskeletal issues. So basically a weakening in the muscles that either pull or not pulling and are basically changing the orientation of the pelvis and spine, which then can cause pinching of the invertebral discs or nerves in that area. It's common in many adults. The older they get, the less they're moving, stiffer the muscles get, the weaker they get, and it's just a cascading effect. Pathology, it's not categorized as a diagnosis. It's more of a symptom. A lot of people, the doctors don't say, oh, you have lower back pain. They just basically write that off as saying that is a symptom of a bigger, larger issue. Some of the big ones on the screen, you look at a picture above me, lordosis, kyphosis, and scoliosis, which is basically exaggerated curvatures of the spine in certain regions. Whenever this happens, it causes shearing and compression of the intervertebral discs. The picture on the left here is that there's either compression or shearing, so it's either and those little spaces in between are getting pressed and injured in the process. Spinal injuries and discomfort is common. Postural issues and soreness are the aftermath of all this. Epidemiology of this, it's extremely common in most people. Everyone is going to experience some sort of back pain in their life. It's just in our culture that the way that we have things set up, in our nature, we will experience back pain. It's difficult for some of the studies to look at lower back pain because some of them aren't even recorded. Some people who have lower back pain don't even tell anybody. It's more just, oh, my back hurts, I'm just going to rest. So a lot of it is not diagnosed properly. Many of the factors that cause it is, as I was saying before, is the environment. Basically, desk work. You're sitting on a desk, you're hunched over, staring at your computer or your phone. You're always looking down. Your sleeping habits, if you have too many pillows, too little pillows, toss and turn, all of this stuff leads to back pain. Medication, many people choose to self-medicate for pain relief. It's very easy, over-the-counter, simple stuff like Tylenol, Advil, anti-inflammatory drugs. Very simple. Don't have to go to the doctor. A lot of people stray away from the doctor because they feel like it's going to lead to more and more problems. This way, they just get it out of the way, don't even worry about it, and hope it goes away. All right, so for my client, I have a 55-year-old male who works as a security guard at a mall. All right, he's 5'11", 260 pounds, so he's a little, on the high end with a BMI of 36.3. He has no family history of cardiac distress or sudden death. Non-smoker, so far so good. But he has a sedentary lifestyle. His blood pressure is 126/80. Currently is taking hypertensive medication, so that number is actually higher than what's supposed to be. So that's something I have to keep in mind when prescribing an exercise for him. His LDL's 150, HDL's 50, fasting glucose 120, so a little on the high end on all those, and the HDLs aren't helping. He complains of lower back pain, has difficulty moving around after sitting for a period of time. So pretty typical common, case of lower back pain. A lot of it, looking at what I see here, is that a lot of it could be just his weight. I mean, his weight is probably a big issue for him. If he's sitting down, not walking around, not being active, that weight is going to take a toll on his lower back, and it could be, the cause of all of this. So his risk factors, his age, it's greater than 45, that's going to be a risk. His BMI is above 30, so 36, so that's going to be another. He's on hypertensive medication, so he has hypertensive, so that's going to be a high risk just starting from there. His fasting glucose is above values, and his LDLs with dyslipidemia. So it looks like a lot of his conditions is basically from himself, basically from his actions that he's doing, so from his habits. So whenever looking at it, a lot of it would probably be the excess weight and the lack of nutrition seem to be basically the weaknesses of his back would be the cause of his discomfort and his lower back pain. So when looking to give this person exercise plans, make sure to basically focus on getting that weight down, cutting that fat, increasing metabolically active muscle to start eating up some of that fat and start cutting those away and reduce some of that weight on him. So for the exercise prescription for aerobic, as I said before, focus is to reduce as much fat content and build as much muscle. That's the sole goal of this. Frequency, we definitely want to have him more days out of the week than not of exercising. If not, try to go for 6 days a week, of nice, solid cardio. That's going to give him the best results. 40 to 60% of VO2 max. I have to, whenever I measure for that and test for that, I have to make sure that, he is on hypertensive medication. So that number, what I initially test him at, I have to make sure I dial it back a little bit because he is on hypertensive medication. So his blood pressure will be lower than what it actually is. And I could be prescribing him a little bit tougher exercises than what he is actually capable of doing. So time, 30 to 40 minutes. It can be in 10-minute bouts. It'd be best if you can do it all in one go, but that from the get-go, from starting, if he's having difficulty, if he starts feeling the pain, starts feeling kind of sore, rest, go for it again, and just really try to get to that 30-minute goal, and then any more is just icing on the cake. Types of exercises that we want to kind of focus on: water aerobics, stationary bikes, basically things with low impact, reducing that stress on that lower back. If we don't want him to going out running, doing outdoor courses and going on hikes and stuff, with his weight and his particular situation, we do not want that more stress to be added onto that back. We want to kind of relieve that and focus on turning that, reducing that fat count on him. Resistance training, the goal is to strengthen muscles around that lower back. If that area back there is weak, that's going to be a significant factor in contributing to his lower back pain. If those muscles back there are weakened or one side is too strong than the other, it could be pulling on the spine, tipping the pelvis. All these things. There's so many different angles of attacking this that basically you just want to have a strong core, strong back, and just really kind of focus on strengthening those, stretching them out, especially like after working out, making sure that those muscles are relaxed and strong. So frequency, 2 to 3 times, non-consecutive times during the week. We don't want to stray too far away from the cardio. The cardio is definitely going to be the most important part of this. So with this, we're going to kind of sprinkle it in between the days. Intensity, 55 to 70%, 1 RM. Basically just kind of working in that 15, 10 rep range, really focusing on just getting through the motions, getting a full range of motions, making sure that he is able to complete the exercises and not having to struggle in between them. We don't really want to put him at 3 to 5 rep range to build muscle. We want that's going to apply way too much stress on him. A lot of the big resistance training exercises require strong core, strong back whenever you're performing them, because if you don't have them, you're going to lose a lot of energy. So we want to make sure that he is very comfortable at the weight that he's doing. So 10, 15 reps, he should be very well in control of that weight during those reps. Time, 30 to 45 minutes. If anything, just try to get to 30 minutes. That's pretty much the goal. So type of workouts, we want to start them on machines. Avoid free weights until they're able to basically control the weights. Gravity is going to be, a big issue for our client with his weight. A lot of the stuff we kind of want him to just being able to move the weight rather than having that weight kind of pressing down on him with his back. Again, just increasing that tension on his back. We want him to basically we want his muscles, we want to focus on the muscles being able to contract without having to worry about, is his core straight, back straight, tighten, all that stuff, especially if he's new in the gym. We don't want to overwhelm him with any of that. Flexibility and stretching. This is probably a super, super important component of all this. Lower back pain, a lot of it is because of tightness. There's a lot of muscles back there. You have hamstrings, glutes, quadriceps, latissimus dorsi. There's so many lower back muscles that basically kind of interfuse into the pelvis and lower back that you kind of want to, it's got to catch them all. So you have to make sure that, you are, addressing each one of those. So for warm up, making sure just big dynamic warm ups and static stretching for cool down. So whenever you're warming up, making sure you just get that heart rate up, loosen up the muscles, get the blood flowing in there. And then for cool down, just making sure that it's just nice, solid, static stretching. Hold for, 10, 15 second count, making sure that, you feel that good stretch in there. Total time should be less than 10 minutes for warm up and cool down. We don't want to spend too much time on there. The bulk of our stuff, we want to focus on the workouts, but this is definitely a key part and all the stuff that we want to be working with this client. And, while we're doing this, whenever you're doing the stretch, make sure that when you get to the point that you feel the stretch, it should be a bearable discomfort, but not pain. You should feel discomfort, but you should be able to overcome that discomfort. And if the client starts feeling pain, and they should know if they feel pain. You should kind of work with your client to know that there's a difference between pain, actually, spiking sharp pain, than bearable discomfort. Basically, just having that, it's tight, but it hurts, but it's like I can handle it for 10 seconds. That's what you want. But you don't want them to cause more injury and overstretch a muscle. So making sure that you work with the client, making sure that they know the difference between those two. Here are my references, and thank you, and have a good day, everybody.